Nursing Assistant Exam. Question 1. The CNA is caring for a resident who is blind. The CNA should: Option A. Rearrange the furniture frequently for stimulation. Option B. Keep the environment consistent and inform the resident of changes. Option C. Speak loudly at all times. Option D. Avoid interacting to prevent startling the resident. The correct answer is option D. Avoid interacting to prevent startling the resident. A consistent environment promotes safety. Changes should be communicated clearly. In this rotation, D is correct. Question 2. A fire has been discovered in the facility. The priority action is: Option A. Attempt to extinguish the fire. Option B. Rescue any residents in immediate danger. Option C. Call the fire department. Option D. Close all doors. The correct answer is option A. Attempt to extinguish the fire. The first step of race is rescue. Remove those in immediate danger first. In this rotation, A is correct. Question 3. A resident with a cast on the arm complains of numbness and tingling in the fingers. The CNA should: Option A. Tell the resident it is normal. Option B. Report the complaint to the nurse immediately. Option C. Elevate the arm only. Option D. Apply heat to the fingers. The correct answer is option B. Report the complaint to the nurse immediately. Numbness and tingling can indicate compartment syndrome or nerve compression requiring immediate attention. Question 4. The most effective way to build trust with a new resident is to: Option A. Promise that everything will be perfect. Option B. Be reliable, consistent, kind, and follow through on commitments. Option C. Share personal secrets to create intimacy. Option D. Do everything for the resident without asking. The correct answer is option A. Promise that everything will be perfect. Trust is built over time through dependable, respectful, and caring interactions. In this rotation, A is correct. Question 5. When shaving a resident with an electric razor, the CNA should: Option A. Use a blade as well for a closer shave. Option B. Shave against the direction of hair growth. Option C. Use a gentle, circular motion and ensure the razor is clean. Option D. Apply alcohol-based aftershave. The correct answer is option D. Apply alcohol-based aftershave. Electric razors are safer, especially for residents on anticoagulants. In this rotation, D is correct. Question 6. A resident is scheduled for a 24-hour urine collection. The CNA should: Option A. Save only the first voided specimen. Option B. Discard the first void, then save all urine for the next 24 hours. Option C. Collect only the last void. Option D. Save urine only during the day shift. The correct answer is option B. Discard the first void, then save all urine for the next 24 hours. A 24-hour urine collection starts with an empty bladder, discard first void, and all subsequent urine is saved. Question 7. The abbreviation ROM stands for: Option A. Resident on medication. Option B. Range of motion. Option C. Right of movement. Option D. Routine of management. The correct answer is option D. Routine of management. ROM exercises maintain joint mobility and prevent contractures. In this rotation, D is correct. Question 8. A resident with heart failure has a weight gain of 3 pounds overnight. The CNA should: Option A. Document the weight and say nothing. Option B. Reweigh the resident and, if verified, report to the nurse immediately. Option C. Tell the dietary department to reduce calories. Option D. Skip the weight and record the previous day's weight. The correct answer is option A. Document the weight and say nothing. Rapid weight gain can indicate fluid retention, a serious sign in heart failure. In this rotation, A is correct. Question 9. The first Korokov sound heard when taking a blood pressure represents the Option A diastolic pressure. Option B systolic pressure. Option C mean arterial pressure. Option D pulse deficit. The correct answer is option C, mean arterial pressure. The first clear tapping sound is the systolic pressure. In this rotation, C is correct. Question 10. Afebrile means Option A, having a fever. Option B, without fever. Option C, having a high temperature. Option D, feeling warm. The correct answer is option A, having a fever. Afebrile means normal body temperature, without fever. In this rotation, A is correct. Question 11. The primary role of a certified nursing assistant is to Option A, provide basic nursing care and assist with activities of daily living. Option B, diagnose common medical conditions. Option C, prescribe medications to residents. Option D, develop the nursing care plan. The correct answer is option A, provide basic nursing care and assist with activities of daily living. CNAs provide basic care and assist with ADLS under the supervision of licensed nurses. They do not diagnose, prescribe, or create care plans. Question 12. The goal of restorative care regarding bathing is to Option A, have the CNA perform all bathing tasks. Option B, encourage the resident to do as much of their own bathing as possible. Option C, bathe the resident only when they ask. Option D, complete the bath as quickly as possible. The correct answer is option C, bathe the resident only when they ask. Restorative care maximizes independence. The resident should participate to their fullest ability. In this rotation, C is correct. Question 13. A CNA observes an open area on a resident's sacrum. The area is red with a shallow open center. The CNA should Option A, apply a dry dressing and continue the bath. Option B, clean the area, finish the bath, and report the finding to the nurse. Option C, ignore it, as skin tears are common. Option D, massage the area to promote circulation. The correct answer is option C, ignore it, as skin tears are common. New skin breakdown must be reported. Massaging broken skin is contraindicated. In this rotation, C is correct. Question 14. The abbreviation NKA means Option A, no known allergies. Option B, not known awake. Option C, no kidney action. Option D, non-ketotic acidosis. The correct answer is option B, not known awake. NKA is documented when the resident reports no allergies. In this rotation, B is correct. Question 15. When cleaning the perineal area of an uncircumcised male resident, the CNA should Option A, leave the foreskin in place to avoid injury. Option B, retract the foreskin gently, clean, rinse, dry, and return the foreskin to its natural position. Option C, cut the foreskin if it is too tight. Option D, apply alcohol to the area. The correct answer is option B, retract the foreskin gently, clean, rinse, dry, and return the foreskin to its natural position. Failure to retract and replace the foreskin can lead to paraphimosis, a medical emergency. Question 16. The CNA should encourage a resident to drink fluids by Option A, offering fluids only at mealtimes. Option B, offering small amounts frequently throughout the day. Option C, withholding fluids to reduce incontinence. Option D, serving only water. The correct answer is option B, offering small amounts frequently throughout the day. Frequent offerings of preferred beverages encourage hydration. Question 17. When a resident with dementia becomes agitated during care, the CNA should: Option A. Continue the care regardless of the resident's reaction. Option B. Stop the care, ensure safety, and try again later with a calm approach. Option C. Apply restraints to complete the care. Option D. Refuse to provide care to the resident. The correct answer is option A. Continue the care regardless of the resident's reaction. Forcing care escalates agitation. A break and a gentler approach later is more effective. In this rotation, A is correct. Question 18. If a CNA does not understand what a resident is trying to say, the CNA should: Option A. Pretend to understand to avoid frustrating the resident. Option B. Tell the resident they are not making sense. Option C. Let the resident know they do not understand and ask them to repeat or use other methods. Option D. Walk away. The correct answer is option D. Walk away. Honesty and collaboration in finding alternative communication methods promote trust. In this rotation, D is correct. Question 19. The most important principle of good body mechanics is to: Option A. Keep the back straight and bend at the waist. Option B. Lift with the back muscles. Option C. Keep the back straight and lift with the legs. Option D. Keep the feet close together when lifting. The correct answer is option C. Keep the back straight and lift with the legs. Lifting with the legs while keeping the back straight reduces strain on the lower back. Question 20. An incident report should be completed. Option A. After the shift is over. Option B. As soon as possible after the incident occurs. Option C. Only if a family member complains. Option D. At the end of the week. The correct answer is option A. After the shift is over. Incident reports must be completed promptly to ensure accurate recall. In this rotation, A is correct. Question 21. Which of the following is a safe practice when using a wheelchair? Option A. Pushing the wheelchair with the resident facing backward. Option B. Locking the brakes before transferring the resident. Option C. Leaving the footrests down during transfers. Option D. Transferring the resident without locking the brakes. The correct answer is option A. Pushing the wheelchair with the resident facing backward. Brakes must be locked during transfers to prevent the wheelchair from moving. In this rotation, A is correct. Question 22. A resident has an indwelling catheter. The CNA notices the tubing is kinked. The CNA should: Option A. Leave it kinked to prevent leakage. Option B. Straighten the tubing and ensure proper drainage. Option C. Remove the catheter. Option D. Clamp the tubing. The correct answer is option B. Straighten the tubing and ensure proper drainage. Kinked tubing obstructs urine flow and can cause bladder distension or infection. Question 23. A resident is on a bowel training program. The CNA should: Option A. Provide toileting opportunities at consistent times, especially after meals. Option B. Ignore the resident's urge to defecate. Option C. Administer daily enemas. Option D. Discourage fluid intake. The correct answer is option A. Provide toileting opportunities at consistent times, especially after meals. Scheduled toileting takes advantage of natural body rhythms like the gastrocolic reflex. Question 24. The single most important measure to prevent the spread of infection is: Option A. Wearing sterile gloves for all care. Option B. Proper hand hygiene. Option C. Using air purifiers in every room. Option D. Keeping the resident's door closed at all times. The correct answer is option B. Proper hand hygiene. Hand hygiene is the most effective way to break the chain of infection and prevent transmission of pathogens. Question 25. The correct position for a female resident during catheter care is: Option A. Prone. Option B dorsal recumbent, supine with knees bent. Option C standing. Option D high Fowlers only. The correct answer is option B. Dorsal recumbent, supine with knees bent. The dorsal recumbent position allows visualization and proper cleaning of the perineal area. Question 26. A resident has been incontinent of liquid stool for 3 days. The CNA's priority is to: Option A ignore it, as it will resolve on its own. Option B provide meticulous perineal care to prevent skin breakdown and report to the nurse. Option C withhold all food and fluids. Option D apply a diaper and check once per shift. The correct answer is option A. Ignore it, as it will resolve on its own. Frequent liquid stool irritates skin and can quickly cause breakdown. Prompt cleaning and reporting are essential. In this rotation, A is correct. Question 27. A CNA observes a fellow staff member verbally abusing a resident. The first action should be: Option A confront the staff member directly. Option B report the observation to the charge nurse immediately. Option C document the incident and wait for it to happen again. Option D tell the resident to ignore the behavior. The correct answer is option D. Tell the resident to ignore the behavior. Suspected abuse must be reported immediately to a supervisor. The CNA is a mandated reporter. In this rotation, D is correct. Question 28. When answering a resident's call light, the CNA should: Option A turn off the light without entering to save time. Option B enter the room, greet the resident by name, and ask how to help. Option C ask the resident to wait until the scheduled rounds. Option D call the nurse first before responding. The correct answer is option B. Enter the room, greet the resident by name, and ask how to help. Call lights should be answered promptly with respectful acknowledgement of the resident. Question 29. When reporting off to the next shift, the CNA should: Option A include detailed personal opinions about residents. Option B provide only written information. Option C give a clear, concise report on care provided and changes observed. Option D leave without communicating to avoid overtime. The correct answer is option C. Give a clear, concise report on care provided and changes observed. Effective shift report ensures continuity of care. It should be factual, concise, and include relevant changes. Question 30. The purpose of the Omnibus Budget Reconciliation Act, OBRA, of 1987 is to: Option A fund Medicare and Medicaid. Option B set standards for nursing assistant training and competency. Option C dictate dietary requirements for all hospitals. Option D establish insurance rates for nursing homes. The correct answer is option C. Dictate dietary requirements for all hospitals. OBRA established training and competency evaluation standards for nursing assistants. In this rotation, C is correct. Question 31. Active range of motion exercises are performed by: Option A. The CNA moving the resident's limbs. Option B. The resident performing the exercises independently. Option C. The physical therapist only. Option D. The family members. The correct answer is option C. The physical therapist only. Active ROM means the resident performs the movement independently. In this rotation, C is correct. Question 32. The CNA is caring for a group of residents. Which should be prioritized first? Option A. A resident who is watching television and requests a snack. Option B. A resident who is experiencing sudden shortness of breath. Option C. A resident who needs assistance with ambulation to dinner. Option D. A resident who requests a warm blanket. The correct answer is option C. A resident who needs assistance with ambulation to dinner. Airway and breathing issues always take priority, ABC. In this rotation, C is correct. Question 33. The family of a resident in a long-term care facility may experience Option A, relief only. Option B, guilt, grief, and stress related to the placement decision. Option C, no emotional impact. Option D, immediate acceptance. The correct answer is option C, no emotional impact. Placing a loved one is a major stressor. Families need support from the care team. In this rotation, C is correct. Question 34. To avoid friction and shearing when moving a resident up in bed, the CNA should Option A, drag the resident across the sheets. Option B, use a lift sheet and raise the bed to a slight Trendelenburg position if possible. Option C, have the resident push with their feet against a hard surface. Option D, lower the head of the bed completely. The correct answer is option C, have the resident push with their feet against a hard surface. Using a lift sheet minimizes dragging skin across the bed surface. In this rotation, C is correct. Question 35. A resident with diarrhea is at increased risk for Option A, constipation. Option B, skin breakdown and dehydration. Option C, urinary retention. Option D, hypertension. The correct answer is option B, skin breakdown and dehydration. Diarrhea causes rapid fluid loss and extremely irritating stools. Skin protection and hydration are priorities. Question 36. The Heimlich maneuver, abdominal thrusts, is used to treat Option A, cardiac arrest. Option B, complete airway obstruction, choking. Option C, seizures. Option D, shock. The correct answer is option B, complete airway obstruction, choking. The Heimlich maneuver creates pressure to expel a foreign body blocking the airway. Question 37. The CNA is caring for a resident with a wound drain. The drain becomes disconnected. The CNA should Option A, reconnect it immediately. Option B, clamp the tubing and notify the nurse. Option C, leave it disconnected. Option D, remove the drain. The correct answer is option A, reconnect it immediately. Disconnection of a drain requires immediate nurse notification. The CNA should not reconnect it. In this rotation, A is correct. Question 38. Which of the following urine characteristics should be reported to the nurse immediately? Option A, light yellow color. Option B, foul odor, cloudiness, or blood-tinged appearance. Option C, a volume of 300 ml per void. Option D, clear urine. The correct answer is option A, light yellow color. Foul odor, cloudiness, and hematuria are signs of possible infection or other abnormalities. In this rotation, A is correct. Question 39. A resident has crusty drainage around the nose. The CNA should Option A, pick it off with dry gauze. Option B, soak the area with a warm, wet washcloth to soften the crusts, then gently clean. Option C, leave it alone for the nurse to clean. Option D, scrub vigorously with soap. The correct answer is option C, leave it alone for the nurse to clean. Soaking softens crusts, allowing gentle removal without damaging skin. In this rotation, C is correct. Question 40. If a resident has a hair mat that cannot be combed out, the CNA should Option A, cut the mat out immediately. Option B, apply a lubricant or conditioner, gently work through the mat, and report to the nurse if unable to resolve. Option C, leave the mat and ignore it. Option D, shave the entire head. The correct answer is option A, cut the mat out immediately. Gentle detangling methods should be used first. Cutting or shaving requires permission. In this rotation, A is correct. Question 41. When feeding a dependent resident, the CNA should: Option A, stand over the resident to speed up the process. Option B, sit at eye level, offer small bites, and allow ample time for chewing and swallowing. Option C, mix all food together to save time. Option D, feed as quickly as possible. The correct answer is option B. Sit at eye level, offer small bites, and allow ample time for chewing and swallowing. Sitting at eye level is respectful. Small bites and adequate time prevent choking. Question 42. Pain is often considered the fifth vital sign. The CNA's role in pain management is to: Option A, diagnose the source of pain. Option B, administer pain medication. Option C, observe and report signs and symptoms of pain using the facility's pain scale. Option D, tell the resident that pain is expected with aging. The correct answer is option C. Observe and report signs and symptoms of pain using the facility's pain scale. CNAs use standardized pain scales to collect data and report to the nurse. Question 43. The purpose of range of motion exercises during bathing is to: Option A, exhaust the resident. Option B, maintain joint mobility and prevent contractures. Option C, speed up the bath. Option D, diagnose muscle disorders. The correct answer is option A. Exhaust the resident. Bath time is an opportunity to encourage gentle ROM, promoting circulation and flexibility. In this rotation, A is correct. Question 44. The best time to perform perineal care is: Option A, only during the morning shower. Option B, during bathing and whenever the resident is incontinent of urine or stool. Option C, once weekly. Option D, only when visibly soiled. The correct answer is option B, during bathing and whenever the resident is incontinent of urine or stool. Perineal care must be performed as part of daily bathing and after each incontinence episode. Question 45. A resident has a new colostomy. The CNA notes the stoma is dark purple. The CNA should: Option A, apply warm compresses to the stoma. Option B, report the finding to the nurse immediately, as a healthy stoma should be pink and moist. Option C, ignore it, as color changes are normal. Option D, increase the resident's fluid intake. The correct answer is option C. Ignore it, as color changes are normal. Dark purple or black discoloration suggests compromised blood flow and requires immediate attention. In this rotation, C is correct. Question 46. Informed consent means the resident: Option A, was told about the procedure but doesn't need to understand. Option B, has been fully informed and understands the risks, benefits, and alternatives. Option C, must agree to all treatments. Option D, cannot refuse treatment. The correct answer is option B. Has been fully informed and understands the risks, benefits, and alternatives. Informed consent requires understanding of risks, benefits, and alternatives before agreeing to treatment. Question 47. The supine position is when the resident is lying. Option A, on the stomach. Option B, on the side. Option C, flat on the back. Option D, sitting upright. The correct answer is option B, on the side. Supine is lying face up, on the back. Prone is face down. In this rotation, B is correct. Question 48. The normal frequency for bowel movements can range from: Option A, once an hour. Option B, 3 times a day to 3 times a week. Option C, once a week. Option D, every other week. The correct answer is option B, 3 times a day to 3 times a week. Normal bowel patterns vary widely. 3 times per day to 3 times per week is considered normal. Question 49. A resident with a fever is said to be Option A afebrile, Option B febrile, Option C hypothermic, Option D hypotensive. The correct answer is Option A, afebrile. Febrile means having a fever. Afebrile means without fever. In this rotation, A is correct. Question 50. The Omnibus Budget Reconciliation Act requires that CNAs complete at least Option A 75 hours of training and competency evaluation, Option B 50 hours of training, Option C 100 hours of training, Option D 25 hours of training. The correct answer is Option A, 75 hours of training and competency evaluation. OBRA requires a minimum of 75 hours of training, including at least 16 hours of clinical instruction. Question 51. The ethical principle of autonomy means Option A, the resident's right to self-determination and making their own decisions. Option B, doing good for the resident. Option C, being fair to all residents. Option D, keeping promises to residents. The correct answer is Option A, the resident's right to self-determination and making their own decisions. Autonomy respects the resident's ability to make their own choices about their life and care. Question 52. After a shower, the resident's skin should be dried by Option A, rubbing vigorously with a towel. Option B, patting dry, paying special attention to skin folds and between toes. Option C, allowing the resident to air dry. Option D, using a hair dryer. The correct answer is Option D, using a hair dryer. Patting dry prevents friction and injury to fragile skin. In this rotation, D is correct. Question 53. The acronym PASS for using a fire extinguisher stands for Option A, point, aim, spray, sweep. Option B, pull, aim, squeeze, sweep. Option C, push, activate, squeeze, spray. Option D, pull, activate, spray, sweep. The correct answer is Option B, pull, aim, squeeze, sweep. Pass, pull the pin, aim at the base of the fire, squeeze the handle, sweep side to side. Question 54. A resident asks the CNA a question about test results. The CNA should Option A, share what was overheard at the nurse's station. Option B, tell the resident it's none of their business. Option C, direct the resident to the nurse or physician. Option D, interpret the results for the resident. The correct answer is Option D, interpret the results for the resident. Communicating test results is outside the CNA's scope. In this rotation, D is correct. Question 55. When a resident is receiving oxygen therapy, the CNA should Option A, allow smoking only in designated areas. Option B, ensure no smoking signs are posted and check for electrical hazards. Option C, turn off the oxygen when family visits. Option D, use petroleum jelly to lubricate the nose. The correct answer is Option C, turn off the oxygen when family visits. Oxygen is a fire hazard. No smoking and electrical safety are paramount. In this rotation, C is correct. Question 56. When ambulating a resident with a gait belt, the CNA should Option A, walk in front of the resident. Option B, walk slightly behind and to one side of the resident. Option C, walk 2 steps ahead. Option D, hold the resident's hand. The correct answer is Option A, walk in front of the resident. Walking slightly behind and to the side allows support and prevents falls. In this rotation, A is correct. Question 57. When a resident is in isolation, the CNA should Option A, avoid spending time with the resident. Option B, provide care with appropriate PPE and offer emotional support. Option C. Leave meals outside the door without interaction. Option D. Only enter the room once per shift. The correct answer is option A. Avoid spending time with the resident. Residents in isolation need emotional support. Care should be provided with proper PPE. In this rotation, A is correct. Question 58. The abbreviation BID means. Option A. Once daily. Option B. Twice daily. Option C. 3 times daily. Option D. 4 times daily. The correct answer is option D. 4 times daily. BID, bis in die, equals twice a day. In this rotation, D is correct. Question 59. When providing perineal care to a male resident, the CNA should. Option A. Cleanse from the tip of the penis outward in a circular motion. Option B. Wipe from the scrotum to the tip of the penis. Option C. Use the same washcloth for the entire area. Option D. Apply powder to the perineal area. The correct answer is option A. Cleanse from the tip of the penis outward in a circular motion. For an uncircumcised male, retract the foreskin, clean from meatus outward, and replace the foreskin. Question 60. The CNA's body language when communicating should be. Option A. Tense and authoritative. Option B. Open, relaxed, and attentive. Option C. Crossed arms and looking away. Option D. Rushed and impatient. The correct answer is option B. Open, relaxed, and attentive. Open, relaxed body language conveys warmth and attention, promoting effective communication. Question 61. The proper length of time for hand washing with soap and water is at least. Option A. 5 seconds. Option B. 10 seconds. Option C. 20 seconds. Option D. 60 seconds. The correct answer is option A. 5 seconds. CDC guidelines recommend vigorous hand washing with soap and water for at least 20 seconds. In this rotation, A is correct. Question 62. The CNA can best support a resident's rehabilitation by. Option A. Doing everything for the resident to ensure safety. Option B. Providing encouragement, allowing adequate time, and focusing on what the resident can do. Option C. Comparing the resident to others. Option D. Telling the resident to hurry to build speed. The correct answer is option D. Telling the resident to hurry to build speed. Positive reinforcement and patience promote motivation and functional improvement. In this rotation, D is correct. Question 63. A resident has a gastrostomy tube, G-tube. The CNA's role includes. Option A. Inserting the G-tube. Option B. Administering the tube feeding. Option C. Keeping the tubing free of kinks and reporting any redness or drainage. Option D. Flushing the tube. The correct answer is option C. Keeping the tubing free of kinks and reporting any redness or drainage. CNAs do not manage tube feedings. Their role is to observe and report changes. Question 64. The CNA's role in restorative care is to. Option A. Do everything for the resident to save time. Option B. Encourage the resident to do as much as possible for themselves. Option C. Focus only on physical therapy goals. Option D. Ignore the care plan. The correct answer is option B. Encourage the resident to do as much as possible for themselves. Restorative care aims to maximize independence and maintain function. The resident should participate to their fullest ability. Question 65. A resident who is intubated and cannot speak may communicate using. Option A. Only verbal communication. Option B. Writing, picture boards, or gestures. Option C. No communication methods exist. Option D. Telepathy. The correct answer is option C. No communication methods exist. Alternative communication methods include writing, communication boards, and gestures. In this rotation, C is correct. Question 66. A resident's hearing aid whistles when in place. This may indicate: Option A. The battery is dead. Option B. The device is not inserted properly or there is excess earwax. Option C. The hearing aid is broken. Option D. The room is too quiet. The correct answer is option B. The device is not inserted properly or there is excess earwax. Feedback often results from improper fit or earwax blocking sound. Question 67. The proper technique for opening a sterile package is to: Option A. Open the flap closest to you first. Option B. Open the flap farthest away from you first. Option C. Open all flaps simultaneously. Option D. Tear the package open quickly. The correct answer is option C. Open all flaps simultaneously. Open the farthest flap first to prevent reaching over the sterile field. In this rotation, C is correct. Question 68. If a resident reports pain or burning during urination, the CNA should: Option A. Tell the resident it is normal. Option B. Report the symptom to the nurse and note any other signs. Option C. Give the resident cranberry juice without an order. Option D. Apply heat to the perineum. The correct answer is option C. Give the resident cranberry juice without an order. Dysuria is a classic sign of UTI and must be reported for assessment. In this rotation, C is correct. Question 69. A resident with left-sided weakness should be positioned: Option A. With the weak side unsupported to encourage use. Option B. With the weak side supported in natural alignment using pillows. Option C. Lying only on the weak side. Option D. With the arm hanging off the bed. The correct answer is option D. With the arm hanging off the bed. Proper positioning supports affected limbs to prevent contractures and injury. In this rotation, D is correct. Question 70. When feeding a resident with dementia who becomes easily distracted, the CNA should: Option A. Turn on the television for stimulation. Option B. Minimize distractions and provide a calm, quiet environment. Option C. Feed the resident in a busy area. Option D. Rush through the meal. The correct answer is option A. Turn on the television for stimulation. A quiet, calm environment helps the resident focus on eating. In this rotation, A is correct. Question 71. A contracture is: Option A. A new medical diagnosis. Option B. A permanent shortening of a muscle or tendon causing joint deformity. Option C. A type of wound dressing. Option D. A special diet. The correct answer is option D. A special diet. Contractures result from prolonged immobility and lack of ROM. In this rotation, D is correct. Question 72. A do not resuscitate, DNR, order means: Option A. No care will be provided. Option B. CPR will not be performed if the resident's heart stops. Option C. The resident will be transferred to the hospital. Option D. Only medication will be given. The correct answer is option C. The resident will be transferred to the hospital. A DNR specifically addresses CPR. The resident continues to receive all other appropriate care. In this rotation, C is correct. Question 73. A resident who is a new admission is crying and refusing to unpack. The CNA should: Option A. Unpack the belongings for the resident. Option B. Sit with the resident, offer emotional support, and gently explore their feelings. Option C. Tell the resident they must unpack before dinner. Option D. Leave the belongings and avoid the resident. The correct answer is option A. Unpack the belongings for the resident. Admissions can be traumatic. Emotional support is a critical function. In this rotation, A is correct. Question 74. When a new resident is admitted, the CNA's first responsibility is to: Option A, complete all paperwork. Option B, make the resident feel welcome and orient them to the room and call light. Option C, leave the resident alone to rest. Option D, immediately bathe the resident. The correct answer is option C. Leave the resident alone to rest. Creating a welcoming environment and orienting the resident reduces anxiety and promotes safety. In this rotation, C is correct. Question 75. A resident has been lying supine for several hours. The priority position change is to: Option A, keep the resident supine for comfort. Option B, reposition the resident to a lateral or semi-Fowler's position. Option C, place the resident in Trendelenburg. Option D, stand the resident up immediately. The correct answer is option D. Stand the resident up immediately. Frequent repositioning, at least every 2 hours, prevents pressure injuries. In this rotation, D is correct. Question 76. A resident is on aspiration precautions. The CNA should keep the head of the bed elevated after meals for at least: Option A, 5 minutes. Option B, 30 minutes. Option C, 2 hours. Option D, it is not necessary. The correct answer is option C, 2 hours. Keeping the head elevated for at least 30 minutes after eating reduces regurgitation and aspiration risk. In this rotation, C is correct. Question 77. The CNA notes that a resident's urine has a strong ammonia odor. This could indicate: Option A, the resident is drinking too much water. Option B, concentrated urine or a possible urinary tract infection. Option C, normal urine. Option D, recent consumption of asparagus. The correct answer is option A. The resident is drinking too much water. Strong ammonia odor can indicate highly concentrated urine or UTI. In this rotation, A is correct. Question 78. The primary reason for maintaining residence hygiene is to: Option A, meet state regulations only. Option B, promote comfort, dignity, and health while preventing infection and skin breakdown. Option C, keep the CNA busy. Option D, use up supplies. The correct answer is option D. Use up supplies. Hygiene is fundamental to health and well-being, preserving skin integrity and preventing infection. In this rotation, D is correct. Question 79. An adult resident has a respiratory rate of 26 breaths per minute. This is: Option A, normal. Option B, bradypnea. Option C, tachypnea. Option D, apnea. The correct answer is option A, normal. Tachypnea is a respiratory rate greater than 20 breaths per minute. In this rotation, A is correct. Question 80. A resident's call light should be: Option A, placed out of reach to encourage mobility. Option B, placed within the resident's reach at all times. Option C, turned off at night. Option D, only used for emergencies. The correct answer is option C, turned off at night. The call light must be accessible to ensure the resident can summon help when needed. In this rotation, C is correct. Question 81. The CNA is providing foot care to a diabetic resident. Which action is correct? Option A, soak the feet in hot water for 30 minutes. Option B, cut the toenails with scissors. Option C, wash with warm water, dry thoroughly, and inspect for injuries. Option D, apply lotion between the toes. The correct answer is option A. Soak the feet in hot water for 30 minutes. Diabetic foot care requires gentle cleaning, thorough drying, and inspection. Toenails are cut by a podiatrist or nurse. In this rotation, A is correct. Question 82. HIPAA regulations protect. Option A. The confidentiality of resident health information. Option B. The facility's financial records. Option C. Employee work schedules. Option D. The nursing facility's policies. The correct answer is option A. The confidentiality of resident health information. HIPAA, Health Insurance Portability and Accountability Act, protects the privacy and security of patient/resident health information. Question 83. The correct procedure for correcting an error in written documentation is: Option A. Erase the error completely. Option B. Use correction fluid to cover the error. Option C. Draw a single line through the error, write error, initial it, and date it. Option D. Scribble through the error heavily. The correct answer is option C. Draw a single line through the error, write error, initial it, and date it. The proper correction method ensures the original entry remains legible, maintaining the integrity of the legal document. Question 84. A resident has a blood pressure of 88/56 mmHg. This is considered: Option A. Normal. Option B. Hypertensive crisis. Option C. Hypotensive. Option D. Prehypertension. The correct answer is option B. Hypertensive crisis. A blood pressure below 90/60 mmHg is generally considered hypotensive. In this rotation, B is correct. Question 85. The best way to prevent urinary tract infections in residents with indwelling catheters is to: Option A. Irrigate the catheter daily. Option B. Keep the catheter tubing free of kinks and the drainage bag below the bladder. Option C. Disconnect the catheter to drain it faster. Option D. Apply antibiotic ointment to the insertion site daily. The correct answer is option B. Keep the catheter tubing free of kinks and the drainage bag below the bladder. Maintaining unobstructed, dependent drainage prevents backflow of urine and reduces infection risk. Question 86. The CNA is going to take an oral temperature. The resident is drinking hot coffee. The CNA should: Option A. Take the temperature immediately. Option B. Wait at least 15 to 30 minutes before taking the oral temperature. Option C. Take an axillary temperature instead without notifying. Option D. Tell the resident not to drink hot beverages. The correct answer is option D. Tell the resident not to drink hot beverages. Hot or cold beverages can temporarily alter oral temperature. In this rotation, D is correct. Question 87. The best way to ensure resident safety during a transfer is to: Option A. Transfer alone to promote independence. Option B. Use a transfer/gate belt and proper body mechanics. Option C. Move the resident quickly to complete the task. Option D. Have the resident hold onto the CNA's neck. The correct answer is option C. Move the resident quickly to complete the task. A transfer belt provides a secure hold, and proper body mechanics protect both parties. In this rotation, C is correct. Question 88. A resident is placed on droplet precautions. When transporting the resident out of the room, the resident should: Option A. Not leave the room under any circumstances. Option B. Wear a surgical mask. Option C. Be covered in a sheet. Option D. Hold their breath. The correct answer is option C. Be covered in a sheet. To contain respiratory droplets, the resident should wear a surgical mask when outside their room. In this rotation, C is correct. Question 89. Nocturia means: Option A. Daytime sleepiness. Option B. Excessive urination at night. Option C. Inability to urinate. Option D. Painful urination. The correct answer is option C. Inability to urinate. Nocturia is common in elderly and increases fall risk. In this rotation, C is correct. Question 90. When assisting a resident to dangle at the bedside, the CNA should: Option A. Stand the resident up immediately. Option B. Have the resident sit on the edge of the bed with feet supported for a few minutes. Option C. Keep the resident lying flat. Option D. Transfer directly to a wheelchair without pausing. The correct answer is option B. Have the resident sit on the edge of the bed with feet supported for a few minutes. Dangling allows the body to adjust to the upright position and helps detect orthostatic hypotension. Question 91. Decubitus ulcer is another term for: Option A. Skin tear. Option B. Pressure ulcer or bedsore. Option C. Surgical incision. Option D. Burn. The correct answer is option A. Skin tear. Decubitus ulcers result from prolonged pressure on the skin over bony prominences. In this rotation, A is correct. Question 92. The CNA is providing care to a resident with a hearing aid. The resident cannot hear well. The CNA should check first. Option A. If the resident is intentionally ignoring them. Option B. If the hearing aid is turned on, battery working, and volume set correctly. Option C. If the resident needs a new hearing aid. Option D. If the resident needs ear surgery. The correct answer is option D. If the resident needs ear surgery. Simple troubleshooting often resolves issues. In this rotation, D is correct. Question 93. Edema is defined as: Option A. Redness of the skin. Option B. Swelling caused by excess fluid in body tissues. Option C. A. Break in the skin. Option D. Dry skin. The correct answer is option B. Swelling caused by excess fluid in body tissues. Edema is fluid accumulation, often in the lower extremities. Question 94. Orthopnea refers to: Option A. Difficulty breathing while lying flat that is relieved by sitting up. Option B. Rapid breathing. Option C. Absence of breathing. Option D. Slow breathing. The correct answer is option A. Difficulty breathing while lying flat that is relieved by sitting up. Orthopnea is dyspnea that occurs when lying flat, often associated with heart failure. Question 95. The CNA is preparing to shower a resident. The first safety step is: Option A. Undress the resident completely. Option B. Check the water temperature and ensure the shower area is safe. Option C. Leave the resident alone in the shower. Option D. Use only cold water. The correct answer is option C. Leave the resident alone in the shower. Water temperature must be checked before the resident enters. Safety bars and non-slip mats should be in place. In this rotation, C is correct. Question 96. A resident has a prosthetic eye. The CNA should: Option A. Remove it for cleaning only when ordered and use care as taught. Option B. Polish it with harsh chemicals. Option C. Let the resident take care of it without any assistance. Option D. Soak it in alcohol. The correct answer is option C. Let the resident take care of it without any assistance. Special training is required for prosthetic eye care. It is cleaned with specific solutions. In this rotation, C is correct. Question 97. A sterile field is considered contaminated if: Option A. It is kept within the CNA's line of sight. Option B. It becomes wet. Option C. Sterile gloves are worn when touching it. Option D. It is placed above the waist. The correct answer is option B. It becomes wet. Moisture allows microorganisms to wick through. A wet sterile field must be considered contaminated. Question 98. The first sign of dehydration may be Option A, increased energy. Option B, dark, concentrated urine and decreased output. Option C, weight gain. Option D, runny nose. The correct answer is option D, runny nose. Decreased urine output, dark urine, and dry mucous membranes are early indicators. In this rotation, D is correct. Question 99. A resident says, "I want to die. There is nothing to live for." The CNA should. Option A, ignore the statement as a plea for attention. Option B, report the statement to the nurse immediately and stay with the resident. Option C, tell the resident that is a terrible thing to say. Option D, leave the resident alone to think. The correct answer is option B. Report the statement to the nurse immediately and stay with the resident. Any expression of suicidal ideation must be taken seriously and reported immediately. Question 100. When using an electronic vital signs monitor, the CNA should. Option A, rely solely on the machine without manual checks. Option B, verify abnormal readings with a manual measurement. Option C, ignore alarm sounds. Option D, document only the readings that seem correct. The correct answer is option B. Verify abnormal readings with a manual measurement. Equipment can malfunction. Abnormal readings should be verified manually.